But you are seeing the Indian variant, much like the Brazilian variant and the South African variant, as a potential variant of concern. You're making that clear, that this is a very transmissible and infectious variant.
Yes, it has some mutations there, which have been seen in other strains, which give it these properties. We're still waiting to see all the final data on, the vaccine effectiveness, and the effectiveness with monoclonal antibodies. There are studies being done in India looking at breakthrough infections from those who had the vaccine and those who've had prior infection, so the reinfections, to see whether the variant is the predominant affecting strain. But even if that is the case, we know that vaccines are not 100% effective. There will be breakthroughs. It only, again, underlines the fact that we need to take the precautions, the mask wearing and the physical distancing, and the others for some time to come.
Because we are seeing transmissibility and infection spreading in rural India this time much more than we saw last year. Should that be a major cause for worry? Because you know that the public health infrastructure system in parts of rural India is nowhere else as strong as urban India. Already urban India, the system has struggled to cope up with the rising number of cases. Oxygen supplies have struggled. We've struggled with ICU beds. But if it spreads to rural India, that could be worse. Does that concern you that the geographical spread this time appears far wider?
Yes, it's very concerning. Almost every state in India is showing high test positivity rates, I think except for a couple. And every state in India has shown an increase, as you say, in rural and urban. And the worry in the rural areas is, of course, the capacity of the health system. I think we need to think, urgently now about the approach in rural areas. When you have whole villages that are being impacted by this infection, when people do not have the opportunity for isolation and quarantine the way that maybe people who are living in middle class homes in urban areas have, we need to put in place those mechanisms, those isolation centers where people can be cared for and monitored. The primary healthcare centers do not have access to the molecular diagnostics. So we need a triaging approach, a clinical approach, which will treat everyone with suggestive symptoms as though they have COVID and provide them, the isolation and the care that they need, as well as the quarantine. That's the only way to break community transmission. We can use more rapid antigen tests in rural areas, which do not have the molecular tests. We need to involve the communities, the panchayats, the local self-help groups. They are the ones, if they understand what needs to be done, will be able to organize and do it well. This is the time for communities really to be involved in the decision making and in the implementation of the measures. And as I said, it has to be different in urban and rural.